Do you have odd bleeding, recurrent infections, or unexplainable fatigue? These signs and symptoms might be signs of blood cancer. Hematologic cancer, sometimes referred to as blood cancer, impacts the body's ability to produce and utilize red blood cells. Blood cancer can present itself in a variety of ways, including night sweats, bone discomfort, and chronic fatigue and unexplained weight loss. To guarantee a prompt diagnosis and suitable treatment, it is critical to identify these symptoms and seek medical help. By being aware of the warning symptoms, you and your loved ones can take proactive measures to prevent blood cancer from spreading and to diagnose it early on. Since effective treatment depends on early discovery, it is even more critical to recognize the warning signs and symptoms. We'll look at the main blood cancer warning signs in this video that you should never overlook. So let's begin. 1. Unexplained weight loss. Loss of weight that cannot be explained is a common sign of blood malignancy. It could be concerning if you're losing weight without changing your eating or activity routine. Blood cancer-related weight loss is usually sudden and inexplicable, even if your eating habits and appetite remain the same. This may be because as cancer cells multiply, the body's metabolic requirements increase. 2. Persistent fatigue and weakness. Weakness and chronic fatigue are often the first signs of blood malignancy. It may be an indication of trouble if you continue to feel exhausted and unmotivated, even after getting enough sleep. Red blood cells that carry oxygen are fewer in number as a result of blood cancer's effects on the generation of healthy blood cells. As a result of the body receiving insufficient oxygen, this may cause weakness and weariness. 3rd, frequent infections and slow healing. People with blood cancer may have weakened immune systems, leaving them more vulnerable to infections. It may indicate blood cancer if you find yourself getting sick often or needing a long time to recover from routine diseases. White blood cells, which are essential for warding off infections and fostering healing, may have their regular functions disrupted by cancerous cells. 4. Easy bruising and bleeding. Because blood cancer interferes with the body's normal clotting process, it can easily bruise and cause bleeding. If you see a rise in bruises without any apparent cause, or if minor wounds or injuries continue to bleed, you may have blood cancer. Cancer cells have the ability to affect the creation of platelets, which clot blood and stop excessive bleeding. 5. Enlarged lymph nodes and swollen abdomen. An enlarged belly and enlarged lymph nodes are indicative of blood malignancy, especially lymphoma. Lymph nodes are found all over the body and play a crucial role in the immune system. The lymph nodes may enlarge as a result of blood cancer because cancer cells tend to gather there. Additionally, an accumulation of cancer cells in the liver or spleen might result in abdominal swelling. 6. Bone pain and joint pain. Joint and bone pain, particularly in myeloma cases, can be signs of blood cancer. In the bone marrow, cancer cells can build up and cause bone discomfort and fractures. Cancer cells can also induce inflammation, which can lead to joint pain. It's critical to consult a doctor if you have ongoing joint or bone pain that doesn't seem to have an evident explanation. 7. Night sweats. Night sweats, often referred to as nocturnal hyperhidrosis, are periods of excessive sweating that occur while you sleep. Sweating at night may be a sign of lymphoma, a subtype of blood cancer that affects the lymphatic system. Typically, these are severe night sweats that occur regardless of the outside temperature. There are several ways that blood cancer can present itself, so it's critical to be aware of the warning signs that are discussed in this video. Early detection is crucial for the proper management of blood cancer and the improvement of treatment outcomes. If you have any worries about your health, or if you are experiencing any of the symptoms mentioned above, consult a healthcare professional.